What is it that you feel in the medical field is holding people back from even embracing the biome? Because I spoke with Momo and Guru, and they said we were doing fantastic things that medicine hasn't caught up with us yet somehow.
So, and again, Casper, people are going to think this is a very cynical way of looking at the world. But, if you look at it today, our medical industrial complex, everyone in the medical industrial complex makes money when you and I are sick. No one makes money when we are healthy. Right? Now, I'm not suggesting they are bad people. I am not suggesting they are evil people. But the fact is their incentives are just misaligned. So imagine your doctor, who may be the nicest human being, if let's assume all his patients never get sick, how is he going to feed him and his family? Right? How the hospital is going to survive? How is the pharma companies look at the chronic diseases as a lifetime subscriber?
Right.
25-year-old person gets diabetes and they probably have button that says, ka-ching, lifetime subscriber coming up. Right? You got an autoimmune disease. Oh my God, big ka-ching. Right?
Exactly. And you don't even know that you're paying for it because it's taken out of healthcare insurance, right? So it's almost the best business model you have.
Yeah. And here's the worst part. They never want to cure a disease. They want to suppress the symptom. So now think about it, how we do it. Autoimmune diseases, as opposed to trying to figure out, wait a second, why is the immune system attacking our body? Well, is it something, maybe a bacteria or virus that is mimicking the protein that is equivalent of something in our body? Shouldn't we be doing something there rather than, what do? They give you the drug to do what? To suppress the immune system. Hold on for a second. Why did the nature have an immune system if you're going to suppress it? By suppressing the immune system, what happened? Now you are open to all the infections.
Yes.
Right? And it is mind-boggling when you start to think about what happens now. So now you have these people who are constantly for the lifetime on this drug. Now they get more sick because now their immune system is weak. And guess what? Now they make even more money from them, right? So every chronic disease, when they give me the ill, I'll give you the pill. That pill is not benign. That pill, one pill causes 3 more symptoms.
Sure.
I don't know why magically they have pills for those 3 symptoms also. And by the way, those 3 pills cause 9 symptoms.
9 symptoms,
and
yes.
now they have pills for 9. And by the time you get to our age, we are popping more pills than blueberries. And that's a problem right there.
What is it, 12, I think now the average of the American we're taking? Wow.
My point is that, so you're asking me why. So the idea really is that unless someone rethinks this idea of how we incent the medical industrial complex, these are going to continue to happen. But here's the trick. We don't need to do that. It is us. At the end of the day, you and I and millions of others, what if we can empower them to take control of their own health? What if we can make them the CEO of their own health? And here is wonderful thing happen. And anytime there is a disaster or devastation, there is a silver lining in the cloud.
Right.
COVID, in my opinion, COVID has done wonders for healthcare system. And here is why.
Yeah, please.
It has pushed the innovation at least a decade ahead of where it would be. Like telehealth would not exist for a decade, but for COVID. And guess what? The biggest change I see now. It used to be when I used to say, you know what? I don't care. When I get sick, I'll go to the hospital and somebody will take care of me. With the COVID, I'm thinking, wait a sec. I don't want to catch COVID. The last thing I want to do is to go to the hospital and to die. Right? So what has really happened is it is starting to bring the responsibility for our individual health on us. We say, I'm going to wear a mask. I'm going to do the social distancing. I'm going to do all these things to protect myself. It is no longer let my doctor take care of me.
Right.
Now that once you start to do that, guess what? You cannot buy the immune supplements today on Amazon. Everything is sold out. You cannot make them fast enough. What's going on? Individuals are starting to say, I got to take care of myself. I got to protect myself. And I think to me, Casper, what I love about you and what you do, you realized that a decade ago, your dad realized that decades ago, that guess what? There is a power to nature. Food is a medicine. And it's not like you and your dad were something, you invented it. Hippocrates said 2,500 years ago, let food be thy medicine.
Yes.
Guess what? In India and Ayurveda, they have been talking about that for 5,000 years. Chinese medicine has been talking about 5,000 years. And we talk about this gut microbiome, and fecal transplant is such a new thing. In China, they have been doing that for the thousands of years. They used to call them yellow soup, right? When somebody got sick, they gave them a yellow soup, right? That was a fecal matter, right? The point I'm trying to make is that at the end of the day, we are coming to a point where I believe in the next decade, Casper, individuals are going to start to take control of their health. And what is going to happen in the healthcare industry is what happened in every other industry, which is called consumerization of healthcare. That means no longer I have travel agents booking my travel. No longer I have a stockbroker buying a stock for me, and no longer I'm going to have a primary care doctor telling me what to do or what might be happening. I go there today, I have a cough or I'm feeling cold. Oh, you might have a flu. Well, guess what? The flu. It's not a flu. Oh, do you have a COVID? You don't have a COVID. Oh, maybe you have a pneumonia. Oh, yeah, pneumonia. Sure. My point is they have no idea.
No idea.
Guess what? And guess what's going to happen? Now we're going to have these at-home tests, which are going to have all the information about us. And no longer, today, obviously, you get the at-home test, you do the test, and you're going to get analyzed, and you're going to get the information. AI is going to look at the thing, is going to tell you in the app what is going on. And I'll tell you what we do at Viome later. But if you go back and look at, if you think about in the next decade, what's going to happen? Your toilets are going to be analyzing your stool, your urine, every single day. Your mirror is going to be analyzing your body every day. Your tiles at home are going to be measuring your sweat, measuring your weight. All the systems around you are going to be analyzing your voice to say, wait a sec, I think Casper might be depressed. Oh my God, look at Casper, he's walking slow. Maybe he's sick. Or look, when he woke up, it wasn't exactly the same weight he put on the first step. There's something wrong here. The way he's speaking is something is not right here. So my point is constantly being analyzed and looking at the stuff and telling you what to do, right? And that world would be where you will become in control, and it's not you versus the AI. It is you and AI working in conjunction together to make your life better. And a lot of people somehow have this fear of artificial intelligence. Oh my God. Now, guess what happens? The AI is no different than what we use today. So people were afraid of robots. People don't realize dishwasher is a robot, right? It does your dishes. Your Google Maps are your AI. In the beginning, people say, oh, I know how to go there. I'm going to make a right turn. That's a quicker short. And Google is telling me to the left. How dumb Google is. You go right, you get stuck in the traffic, you say, holy shit, should have listened to Google. Next time, when Google says turn left, you're saying, whatever, dude, I'm turning left, right? Point is, suddenly the AI is no longer to control you, but to help you live better, to tell you, hey, you really enjoyed this restaurant, here is another one to try, and you really love it, next time you're believing it, right? And that to me is really what's going to happen is AI and humans are going to start to merge as an entity. That means I may not know a lot about a particular subject, but I'm going to trust my AI to be able to be my agent and guide me and recommend the things to me that I trust, because it's a trusted AI that I believe is there to help me. And then we become this symbiotic relationship with AI.
You know, Naveen, I'm totally on board with you about being bullish and excited for what the next decade has to come, because you could look at the stats, and I do this sometimes too, as to why our companies are so necessary. And you look at over 60, 70, and I think it's now close to 80% of Americans are chronically ill, right? And we're going in this negative trend where it's younger and younger people are getting sicker and sicker. And so that could be a dreadful scenario that you get very fearful for. But I believe that brings up opportunities.